Wide scope of topics for clinical exam, low passing rate, intimidating exam. Show me which exam in planet Earth doesn't have wide scope of topics, low passing rate, and intimidating. If you are a medical student or any doctor preparing for step 2 USMLE step 2 CS or NZREX part 2 or AMC clinical or Canada clinical exam, any exam, these are the same problems. Unfortunately, the topics are the same, the passing rate is the same, and they are intimidating because when you pass these exams, you are actually going to see real people. And when the standards of exams are high, it's not easy and they're not going to let you pass people. So you will just be some silly guy with no knowledge and go and treat these people, and you will be, killing people. So obviously the standards are going to be very high. So you have to practice. You don't have a choice. All you can do is learn the guidelines, learn the frameworks, learn the blueprints that are important for passing the clinical exam or OSCE exam. You don't have a choice. There is no shortcut to this. You need to do role plays, which means it's not a theory exam where you read things and just go and vomit in the exam. It's not a theory exam like that. This is a doing exam. It's a talking exam. So let me write it here. It is a doing exam and talking exam. So you need to have strategies. You need to have frameworks. You need to, learn each country's guidelines because each country has got slightly different standards, but most of the standards are the same. Slightly there might be, for example, if it's breast cancer screening, it might be different in Australia to UK and to US. If it's a colon cancer screening, like fecal occult blood testing, it might be different in UK, US, Australia, but ultimately you still have to screen. So that's the thing. Learning the overall frameworks and strategies are the key. So if you are a medical student or a doctor preparing for this intimidating exam, you can see if this doctor had a problem, you have the same problem. No one on planet Earth will say that OSCE is easy exam. Trust me, your number one student in your medical school or your friend who topped the theory exam will still have the same fear. If it was easy, then anyone will become a great doctor who will pass the exam. So it is an intimidating exam. You need to practice to a time. You need to develop the framework strategies and you need to implement them, not just learning the strategies. Like I teach a strategy called ABCDE approach. When you read a scenario, let's say a 4-year-old child has a rash. Okay. So you use action words, which is 4-year-old child has a rash. He presented to the emergency. So these are action words. B is what will kill this 4-year-old child with a rash. That's the blunder is B. C is what are the common causes of a rash in this 4-year-old child. Then D stands for a mnemonic called, let me get this, direction, which is something I teach in my courses. It's drugs, infections, what drugs will cause the rash, what infections will cause the rash, what rheumatological causes will cause the rash, what endocrine causes will cause the rash, what chest causes will cause it, what traumatic causes will cause it. You might think what traumatic causes, if it's a child abuse, that will be like a bruise, but actually they present it as a rash. What inflammatory problems will cause it, what others will cause it. This is something I teach in my course. It's a special mnemonic I use, and what neoplasms will cause the rash. So these are the things you need to learn. If you don't learn these, then most likely you will fail and you can't manage the time and you will fail. So if you want to get access to the group, which is a free group, by the way, there will be so much free training, free materials. Other people will be paying, and in case if you are paying for that content that is in the group, I'm sorry, you would have bought from an ad and you got it. But if you want this free material where you can pass this clinical exam, any clinical exam on planet Earth, then, and be a good clinician, then you need to email me dr.talari.education@gmail.com. Or if you can see a link anywhere under this video, just get it, put your name and email address, and I will ask you some proof that you are either a medical student or preparing for your Step 2 CS exam or NZREX Part 2 or AMC Clinical or any clinical exam on planet Earth, and I will give you access to this. There are already lots of medical students and doctors in the group, so you will get access to something which some people in the world, somewhere in the world, are paying. So if you want that, make sure you send an email, but you need to send me the proof. Don't just send an email saying, hey, can you join me to the group? I need a proof that you are preparing for your clinical exam, and I will join you there. And this is a group where you can actually see my free training programs. And if you like it, yes, you can join my group coaching program, where 3 times a week, every week, we jump on a call and you pay on a weekly basis. And you will learn all the strategies. If you don't like it for any reason, you can always say, I don't want to continue it, but you will love the community, you will love the support, you will love the training programs, all my courses, you will have access to them. And ideally, I would say minimum of 8 weeks is what is needed to actually smash this exam, to learn everything, because every week, if you're jumping on the call, listening to what other students are saying, then you get to access to all the role plays from other doctors. Then you get to learn the strategies which are not in any medical book. You will be extremely successful. You will be a great clinician, or you might stay for life because you're learning all these things, and you will be a great doctor. So I wish you all the best. Make sure you send the proof, or if there is a link or something here, make sure you actually enter your details, and I will see you inside the group.